The Government Employees Medical Scheme says it has spent 8.2 billion rand on COVID-19 related claims by civil servants and their family members since the outbreak of the pandemic in March last year. It says a big chunk of the money was not budgeted for as the outbreak took everyone by surprise. Our reporters Tshepo, Mongoai and Mbongeni Muthwa have more on this.
The Government Employees Medical Scheme was established 14 years ago to cover the country's 1.2 million civil servants and their families. Currently, 760,000 civil servants have signed up with the scheme. With their family members, they bring the number of beneficiaries that are covered by the scheme to over 1 million. James says the surprise outbreak of the pandemic last year cost it dearly.
From just around March last in 2020, when we had the first case in South Africa. By the end of 2020, we had spent about 3.2 billion rands relating to COVID costs.
Costs have tripled this year as the country went through several waves of COVID infections.
As recently as July, because of we've had 3 waves now of the pandemic, that the claims that we have paid in respect of COVID-related claims is it's about 8.2 billion rands.
400,000 members of the Government Employees Medical Scheme have tested positive for COVID-19 so far. 7,000 of them have succumbed to the deadly pandemic. Against this background, Dr. Mwabi says the high costs that are being incurred by the scheme are understandable.
The government employees are at the forefront of service delivery. We have a lot of healthcare workers, and as a result, they were affected by COVID. We do see, however, the impact of vaccination in that now we are seeing amongst the healthcare workers that there's less of them who are testing positive, because we know that a big percentage of them vaccinated as part of the Sisonke trial.
The good news, though, is that the scheme is still in a healthy financial position, which puts it in a good position to continue taking care of the medical needs of civil servants and their families well into the future.
The reserve requirements for all medical schemes is that you have to hold 25% of your annual contribution income in reserves. At the moment, as at the end of 2020, which is the last reporting year, where our reserve was at 41.1%. And as at the latest reporting period, in terms of our quarterly reporting, we were still in the region of 40% reserves. So what is happening is basically financially we are very strong.
But fraud, waste and abuse is a big concern for medical aid schemes in the country. A symposium held by medical aid schemes this week heard that medical aid schemes are losing around 20 billion rand to fraudulent claims by medical services providers every year. Mbongeni Muthwa, SABC News, Johannesburg.